Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a Lyme webinar where we talk about Lyme disease, of course, and you create this webinar with your questions. No 2 weeks are the same because every time there's a different set of questions that get asked. Sometimes we get into a theme of the night with the questions. That's not with any planning on my part, and I don't think it's with any planning on your part either, but sometimes that happens. I did take last week off, and I'm glad to be back with you here this week. I will be with you again next Thursday as well, too. So I just wanted to bring that up here to begin with. I am doing a recording of the webinar tonight. I will send out an email to you somewhere around 9:30-ish Central Standard Time tomorrow, and that will have the link to where you can see the recording. It'll also announce that the recording is ready to be viewed too, and it'll have a sign-up link for the webinar next week, okay? Now, if you happen to miss that email, there's many places you can see the recording of the webinar. So my Lyme disease information site, Treat Lyme by Marty Ross MD, is at treatlyme.net. And you can find the recording on the homepage down at the bottom, or you can find a copy of the recording on the webinars page there, okay? I also have a supplement store called Marty Ross MD Supplements at treatlyme.com, not at .net, but at .com is where the store is. And you can find that recording on the homepage down towards the bottom as well, too. I posted on Facebook, and my Facebook page is Facebook.com/Treat Lyme. I also have a YouTube channel, too, at Marty Ross MD. So many places that you can find that recording if you happen not to get the email, okay? There's a number of new names here tonight that I can see on the attendance board, so I'm glad to see some new people here. I hope you get something out of this tonight. I hope you find something that can help you. And there's a lot of return people here tonight, too, and I'm glad to see some familiar names and familiar people back here again, too. So the way these webinars work, again, you create them with your questions, and you write the question down here on the bottom, on the right-hand side of the screen. Down at the bottom is a chat box. Write your question there. I ask that you don't hit the enter key until the whole thing is done. If you happen to hit the enter key, it sends multiple questions to me, and it gets hard to track from my side, okay? I will post the questions so that those of you that are participating in the live version can see the question posted on the screen, usually. That's the way it's supposed to work, at least. But in the recorded version, it doesn't show up, so I will also read that question as we get into it, too, okay? All right, now, one other thing. I cannot answer specific medical questions about your specific problem, okay? Because that would be called treating you. And in a webinar format, I can't do that. I can't gather enough information. Secondly, I live in Austin, Texas, where I'm not licensed to practice medicine. I still am licensed to practice medicine in Washington State, but because I'm delivering the webinars from here, I can't exactly answer specific questions to tell you exactly what to do about your health. Now, I can use those kind of questions as a platform to discuss treatments in general and maybe give you some ideas, but I can't specifically design a treatment just for you, nor can I do a diagnosis just for you. Okay, so just be aware of that as well, too. All right, so without any further ado, let's go ahead and get started. We'll take the first question here. Hello, Colleen. Let's see. If a patient is bedbound with Lyme and chronic fatigue syndrome with weakness and severe post-exertional malaise, even after doing the smallest of things, how can they avoid deconditioning? Thank you so much for helping us all with your knowledge and information. You're welcome. That's a hard problem. On the one hand, exercise can help improve your outcomes with Lyme disease, but at a point, it also can hurt you. And the difficulty is that early in treatment, sometimes people just can't exercise, even if it means that they're going to be deconditioned from it, okay? One of my colleagues, a guy named Dr. Burrascano, many of you may know him, was a Lyme disease doctor that treated people out in New York State. He's one of the pioneers. He's who kind of led the way, and many of us learned from him. He advocated that people should not do anything aerobic exercise-wise, and that basically they could do type of exercise that would involve literally just moving your arms or legs even while laying down. So just moving them, okay, to stay in some kind of motion. And for some people, I think when they really are in a state where any kind of motion or minimal activities will make things worse for them, that may be all you can do. the rule of thumb that I have for exercise with my patients is that to try to be in some kind of motion, do some kind of exercise, but you have to do it to tolerance. And what that means, because everyone's got different levels of tolerance, is you find a level of whatever exercise you're doing and do an amount that doesn't leave you worse off the next day. Okay. That post-exertion fatigue is very common in Lyme. And so that may mean literally the most you can do right now is lay in bed and maybe for 5 or 10 minutes a day, just literally move your arms or legs. That may be the most that you could do at this point, okay? And if that's all you can do, that's okay, because that's all you can do, okay? Because you have to be careful not to push too hard, because you may, overexertion, overactivity may make you worse. It may even lead to some suppression of the immune system as well too, all right? So now about Dr. Roscana, I don't agree that you can't do aerobic exercise with Lyme. In fact, I had a number of patients that we would get them well enough at a point in their treatment, they would start adding back in aerobic treatments. And I think it was actually quite helpful to be able to do that, as long as they followed the rule that you don't do more. You find your level of tolerance. So don't do an amount of activity that makes you feel worse the next day. So for instance, I had an ultra marathoner in my practice, and she did quite well. She did quite well. At a point she couldn't run, but she eventually got well enough. She was slowly able to add back in exercise and started running ultra marathons. Okay, so it's very possible. All right, thanks for that question, Colleen. Hello, Wendy. Let's see, if you've had chronic Lyme for 10 years and became infected with acute Lyme, can your adaptive immune system eradicate the infection without antibiotics? It's a good question. I mean, with some, the idea with germs in general is that for some germs, when we've been infected with them, we develop immunity against that germ. Okay, so for instance, if you've ever had hepatitis, well, that's probably not going to be the best analogy. If we give an idea, would be like using vaccines. So if we give somebody the polio vaccine, we give them a live attenuated virus, a weakened version of the germ, and it gives a mini infection, if you will, and the immune system learns to adapt to fight the real infection when it comes in. Okay, so that would be an example of that. To be honest with you, is if you've had chronic Lyme in your immune system and you've gotten over it, your immune system has the germ under control, and then you get an acute infection, does the immune system then stand a better chance of dealing with that acute infection? The truth is, I don't know. No one's done studies about that. I have seen I'm doubtful that the immune system would be able to get under control, because typically, if somebody has developed chronic Lyme, that means their immune system already had difficulty dealing with the infection and was set up in a way that it had a hard time dealing with it, okay? All right, so the odds are, if that person got reinfected again, their immune system still may not be adequately designed to deal with the Lyme germ, okay? Now, there's a lot of things that determine how well the immune system works. So for instance, if you first got sick and you were living under a very stressful environment, and you had multiple toxins in you, and you had all these things in you that suppress the immune system, it may be why Lyme was able to get a foothold, okay? And then after you go through a chronic Lyme treatment, you start detoxifying better, you get out of really stressful situations, your immune system starts working better. Maybe when you get that next round of infection, your immune system's gonna do better, all right? Now, having said that, I also wanna let you know that there are people, it is my opinion that anyone that gets a Lyme infection does not necessarily go on to get Lyme disease. So Lyme infection in you does not mean Lyme disease, all right? Think about that word. Lyme disease is dis-ease. It means that the immune system in some people is not able to get that germ under control well enough, and eventually they get sick from having the germ in them. But just like in any infection, some of our immune systems, I believe, have the ability to deal with Lyme. And there may be a lot of people walking around out there that had Lyme infection that their immune systems dealt with it, either by knocking it out completely or by putting it under control in a way that we can cohabitate with it. Okay? All right. So, thanks for that question, Wendy. Hello, Virginia. Dear Dr. Ross, do you think that Bycell injections could help Lyme or any certain co-infection? I heard about a Bycell and diflucan Lyme protocol. Thank you. So, Virginia, yeah, so Bycell, so in terms of Lyme treatments, and I talk about this in my article, A Lyme Disease Antibiotic Guide. I'll show that all to you later. When we design Lyme treatments, we design them with the idea in mind that there are different places that the Lyme germ lives. So it lives inside of cells and outside of cells. So we have to use antibiotics that can get inside cells, and we have to use antibiotics that work on the outside of cells. Okay, all right. The other thing is Lyme exists in two forms. There's a spirochete form and there's a microscopic cyst form. And we have to have antibiotics that treat those two forms as well too, all right? So there's a group of antibiotics which are known as the cell wall agents. They basically work on the outside of the Lyme spirochete, and they they make it so that the germ can't repair holes that develop in its covering. So eventually the germ just gets too many holes and dies, basically, okay? So the cell wall agents are medicines like cefuroxime, amoxicillin, Bycell, Rocephin, or ceftriaxone. Many of you heard of that as an IV antibiotic. That's a cell wall agent as well too, okay? Now, if you're going to use cell wall agents, you have to combine them also with something that's going to work inside the cell. And also, you may need to use a third antibiotic to get at the cyst form of the germ as well too. Okay, that's why you use multiple antibiotics. And I talk about that in my Lyme disease antibiotic guide, all right? So Bycell is a penicillin injection you get in your butt. And it's very useful at maintaining very high or good levels, I should say, consistently good levels of a penicillin in your bloodstream. And it can work as well as an IV antibiotic. It's another way of it's an IV equivalent treatment. It gets these really good levels of drug into you, okay? But because it's only a cell wall agent, we need to combine it with something else, all right? Now, the diflucan may have the ability to treat cyst Lyme, and that could be why somebody's thinking about using it with a Bycell and diflucan, all right? But the trouble is it probably is not a good intracellular agent. If I were to do Bycell and I wanted to use it with just one other drug, what I was doing in my practice was combining it either with a medicine called metronidazole, which is also called Flagyl, or a brother or sister of that medicine called tinidazole, also known as Tindamax, okay? My preference was the tinidazole, though it tends to be more spendy, tends to have less side effects, and there's some evidence that in addition to treating intracellular Lyme and cyst Lyme, that it does a pretty good job of removing biofilm slime layers that cover the germ and block treatment, all right? The diflucan is interesting in that there is where you may be seeing this idea of Bycell and diflucan is probably about a good 14, 15 years ago, there was an English physician named Chart that had come up with what was known as the Chart protocol, okay? And what Dr. Chart liked to do, I believe, was, I think it was 60 days of amoxicillin followed by 30 days of diflucan. It was some arrangement like that. It was use your penicillin, your amoxicillin for a period of time, then follow and use the diflucan, okay? And you alternated. And the reason that he contended that was a good treatment is he believed, based on his review of the science, that one of the things that diflucan did is it blocked some detox mechanisms within the Lyme germ, making it more susceptible to be attacked by the Bycell or amoxicillin in his case, okay? Now, again, amoxicillin and Bycell are in the same family. So maybe if you're seeing this protocol of a Bycell and diflucan, it may be more of a modified Chart protocol. What I can tell you is, although many people tried that Chart protocol upwards of 14 or 15 years ago, most of us did not find much success with it, okay? So Bycellin's great. It's useful for treating only one of the germs in Lyme disease, and that would be the Lyme germ, okay? And it's useful for getting really good levels of blood in your blood so it can get into the brain, get into all the tissues. But if you're going to use it, it needs to be combined with an agent that can go intracellular to get at Lyme living in cells and also to treat the cyst. There is a single drug regimen that would do that, so use either tinidazole or metronidazole, okay? If you cannot tolerate those drugs, then you wind up needing to use at least 2 other things in addition to the Bycell, something that will get inside the cell and something that will treat cyst. For instance, you could use a Biaxin to get inside the cells, and you could use the herb grapefruit seed extract to treat the cyst, okay? Now, I know that's all very complex. Let me show you an article that you can look at this and study it a little bit more. It's my Lyme disease antibiotic guide, where I talk about inside-outside cells and cell wall agents and treating cysts, all that stuff. It's all described there, and I even give you a bunch of sample protocols too. Let me do a screen share here. All right. So this is my Lyme disease information site, Treat Lyme by Marty Ross MD. Okay. So take a look at my online Lyme guide here and look in the section called Infection Treatment Plans. All right. And then the first article in there, at least the first article that I have in there right now, is this article called The Lyme Disease Antibiotic Guide. And in here, I talk about how you design a treatment. One rule is combine antibiotics to treat all forms of the germ, okay? Combine antibiotics to treat Lyme living outside and inside of cells. That's exactly what I was talking about there, all right? And then I talk in here, penicillins, I talk about Bycell being one that you can use. And I say that they treat the spirochete, maybe the cyst. There's some Petri dish experiments that says it might treat the cyst. I never thought it, in practical experience, I did not find it to be that useful, okay? But anyhow, and then in this article, I reviewed the different classes of antibiotics. And then down here, I give you some sample antibiotic protocols, okay? So take a look at this. It gives you some good insights on how do you think about building Lyme disease treatments, okay? All right, let me go back here. All right. Boy, that was long-winded. I hope that gave you information to think about, though. Okay? All right. Thanks, Virginia. Good luck to you. Let's see here. Hello, Christy. Let's see. I am 35, have been sick for 20 years. I have gone through every treatment we could think of, but I am still sick. I want to start seeing a Lyme doctor again, but could my symptoms just be permanent damage now, or is there hope? You know, it's a good question. You know, what I found in my Lyme disease practice when I was treating patients in Seattle, if I had somebody that came to see me in a similar situation like you were in, I would always try to make sure to see what might have been missed. Okay. And I assume you've seen some good people along the way, but where I would start was to make sure that the person, not in addition to treating Lyme, treated co-infections. And I spent a lot of time interviewing patients to try to figure out if there was a co-infection based on clinical symptoms that perhaps the other doctors just missed. It just wasn't obvious to them, okay? Because if you have co-infections like Bartonella or Babesia or Ehrlichia or Anaplasma, and they're not treated, they make it harder to get Lyme under control. All right, that's why I'm focusing so much on that here to begin with, okay? All right, so that's one thing. You may want to, in terms of, I would look back at some of my materials that I have about how do you diagnose Bartonella, how do you diagnose Babesia. I'll show you those in a minute. And basically, it's based on clinical symptoms. So if you had a doctor that was only making decisions about treating Bartonella or Babesia based on blood testing, they may have missed it. And the problem is with Bartonella is we estimate 30 strains. We think 17 can live in people, and we can only test for 2. You see the problem there, okay? And Babesia, the estimates are somewhere around 15 or 20 strains, and really we can maybe test for 2 or 3 strains. So again, even with Babesia, you can miss it. So you got to look at the symptoms, and if you have enough of one of those and they weren't treated, that could be the thing making it so you can't get better, okay? All right. Second thing that I have found that I would always look for in somebody that had seen multiple people, been treated multiple times and just couldn't get well, I would want to make sure that there was not a buildup of mold toxins. All right. And that's because mold toxin illness can look just like Lyme disease, or you could have both. But if you have both and you have mold toxins in you, you're not going to get well. And what may look like Lyme still being active may just be all mold toxin illness. All right. So why do I raise that as an issue? All right. So there is some good science. It's based upon some work by a physician named Richie Shoemaker that shows that approximately 25% of all people have a genetic defect, I'll call it, or a genetic issue, if you will, that makes it so that when they breathe in, drink in, eat in mold toxins from their environment, they can't get rid of them. All right. Now, what happens in 75% of us is if our immune system sees a mold toxin that gets into the bloodstream, it'll tag it as a mold toxin to be removed. And the immune system throughout the body breaks those mold toxins down, and they get peed out and pooped out in broken down forms. Okay. All right. Now, if you're one of the 25%, what happens is those mold toxins don't get tagged. They go to the liver to get cleaned out. The liver is supposed to clean them out because they're a fat substance. Okay. And the liver, though, is not able to transform them as it does. So what the liver is supposed to do with fat toxins, it's supposed to transform them into a water-based toxin. They get moved out into the intestines, mix in our poop, and we poop them out, never to be bothered by them again. But with mold toxins, the liver is not able to do that. The liver sends them back out still as fat toxins. They get out into the intestines, and they get reabsorbed into the bloodstream. They go back into the blood. And those toxins trigger a severe inflammatory excess of cytokines in the body. Now, many of you know the way I describe chronic Lyme disease is it is a syndrome of cytokine excess. So these cytokines are chemicals made by the immune system that are supposed to turn on the immune system, cause more white blood cells to be made, draw those white blood cells to the infection, just get the immune system working well, okay? But in Lyme disease and in mold toxin illness, and sometimes in chronic virus infections, and sometimes in chronic yeast infections, the immune system doesn't do a good job, and it keeps trying harder and harder, and eventually it kicks out too many cytokines. And too many cytokines give you all of those symptoms we call Lyme symptoms. It makes it so you can't think. They give you fatigue. They interfere with how your hormones function. I can go down the list of Lyme symptoms. They're caused by too many cytokines. All right, now, if you've got all these mold toxins stuck in you, triggering cytokines, guess what it's going to look like? It's going to look like your Lyme isn't getting any better because they also trigger all those cytokines, okay? So if your doctors did not do this before, one thing you ought to look at is you're getting back into treatment again, or one thing I would do with a patient in your situation is I would get a urine test from a lab called Real Time Labs to see, and that's out of Austin, or I think they're up in Plano, Texas. I'm in Austin. I think they're up in Plano, Texas, but Real Time Labs. And they do a urine test that can tell you, are you peeing out mold toxins? And if you are, then that needs to be treated. Okay. All right. Now, I know you asked, can you get better? What I'm trying to describe to you is maybe if things were missed. Okay. So if co-infections were missed, yeah, you can get better. If you have mold toxin illness, yeah, you can get better. The other thing is to look at that your doctors ought to consider, and I'll show you the resources I have about this too, is, or that I would consider in somebody in your situation, is I would look to see, did a part of the immune system, a type of immune cell called a mast cell, get overly turned on by having Lyme infection in you? So mast cells are the allergy cells, all right? So they're the cells where histamines are made. And sometimes when we treat people with Lyme, we see that gradually over time, they become more and more allergic, more and more sensitive to everything. And there's a body of science now starting to show that that we had it all wrong in our thinking about mast cells. We used to think that the only thing that caused a mast cell to get upset was things that the body was allergic to. They would land on that mast cell, and that mast cell would release histamines and make a person feel full of allergy symptoms, okay? What we now know is those mast cells also make tons of cytokines, all right? And infections can turn on those mast cells to kick out cytokines and to kick out histamines as well too, all right? So if you've got some evidence of a lot of sensitivities and allergies, Sometimes treating for mast cell activation syndrome can make a difference as well too. All right. So I just want you to know those are 3 things to look at. There may be other things your doctor should look at that are interfering with why your immune system can't get over Lyme. And so in this kind of a situation, I want to let you know there's always hope. All right. But I would start by looking at those kind of situations. You do raise a valid point, though, that in some people, it's possible that it's going to be difficult to recover because the injury from Lyme has created permanent injury. All right. But always, before I would go there and say that to a patient, I would look for what got missed. And the big things that commonly can get missed are co-infections, because you can't rely on the blood test of those. Mast cell activation syndrome. All right. And then also mold toxin illness. All right. All right. So let me just do a quick screen share here. I'm going to show you a few things. Okay. So I'm going to go. I'll do to look at this. I'll just show you a good place that you can kind of come back and look at some of these points. Take a look at my Lyme disease treatment protocol. Okay. And in here, I talk about the basic steps anyone should do as part of their treatment. All right. So this would be for you to consider too, is when you're doing treatment, if some of these steps were not done when you've been treated before, they should be. Okay. These are the steps that I found helpful in helping people recover. Number 1, try to get 7 to 9 hours of sleep. And if you have to use herbs or drugs to do that, do it, because it helps your immune system work better. Okay. Number 2, I found it very helpful to have people that were having a hard time recovering be on a paleo diet. And that is this diet here called the best brain inflammation, pain, energy, and detox diet ever. Okay. It tends to be a type of diet that is not pro-inflammatory, and it helps your energy factories called mitochondria work better so you can heal. All right. Number 3, do things to lower cytokines. I talk about some herbal options there. Number 4, being something that helps your body deal with stress. Those are called adaptogens. I like the herb called ashwagandha. Correct hormonal deficiencies, and I talk a little bit about how to do that here. Be on a good multivitamin. Do some basic detox steps, and big thing I like using is liposomal glutathione for that. Exercise to tolerance. Get yeast out if it's in you. Deal with Lyme. Deal with your co-infections. All right. All right. Then I have a section here that says special considerations. All right. And this is things to consider if you're just not getting better. All right. So I already talked to you about, actually, I should have showed that to begin with. All the way up here at the very beginning of my protocol, I say, before treating Lyme disease, make sure it's not mold toxin illness. That was the point I was raising with you, okay? And I also said, if you're very allergic, make sure you treat for or look to consider if it's mast cell activation syndrome. Those are the 2 points I was raising with you, okay? All right. Anyhow, those are some things for you to think about. Take a look at that whole protocol. You may come up with some other ideas that I didn't cover here as well, too. Okay? All right. I know that's long-winded, but it's not so simple. All right. So the answer is yes, especially if things were missed, you got a great chance of recovery. If things weren't missed and you go back into treatment again, I have to admit, sometimes it is a little harder to recover. Okay? All right. Good luck to you, Chrissy. Oops, I got to bring myself back here. There I am. Okay, here we go. Hello, Barry. Hello, Dr. Ross. What are your thoughts on using essential oils both as an adjunct to prescription meds or as a first-line therapy? Thank you. Hold on here just a minute. Okay, so essential oils are all back in the idea that many of us are considering again. And notice how I said again, all right? So some things cycle around in the world of Lyme. So The reason that a lot of people are wondering about essential oils again is based upon some recent work, some recent research that got published by a medical doctor named Ying Zhang, who's taken his tuberculosis research lab at Johns Hopkins and turned it into a Lyme disease research lab. All right. And so the relationship, why he would go from tuberculosis to Lyme, is that there's an idea in the world of Lyme right now that one of the reasons people are having a hard time recovering is that some of these people might have persister Lyme. All right. In fact, the last question, I meant the last person I was just answering a question of, consider looking at the idea of persister Lyme too. You'll have to look back at my articles about that, but let me talk briefly about persister Lyme. All right. So persister Lyme is an idea that's getting a lot of attention. And essentially what it is it's spirochetes and cyst Lyme that after being exposed to antibiotics for some time, some of those germ forms go into what's called a persister state. And there's been some Petri dish experiments looking at that out of Northeastern University in Boston about 4 or 5 years ago now that showed on Petri dishes that when they're exposed regularly to antibiotics, that about 20% of the spirochetes and about 20% of the cyst turned into these persister forms. And what a persister form is, or a persister state is basically the germ goes into hibernation. It just slows its activity way down. And in that hibernation state, it can ignore the antibiotics. That makes it hard to get over it, okay? And it can ignore the immune system too. Now, the reason that Ying Zhang is researching this is that's the same thing that happens in the world of tuberculosis, all right? Tuberculosis is known as being a persister germ. And so tuberculosis, there's lots of research and common treatments now involve 2 and 3 drugs. And so he thought, why don't I start taking that knowledge and apply it to the world of Lyme disease to help these people that are suffering from it, okay? All right. So one of the things that he has found, he's looked at a number of things, and I write about some of those on my website. I'll show you an article I have about persistent Lyme here in a minute. But one of those that he's most recently looked at is, and he's done some experiments showing that there are a number of essential oils that on Petri dishes do a good job of getting rid of persistent Lyme, okay? So that's why it's back. People are considering this idea of essential oils again. Now, I have to caution you that what happens on a Petri dish is not always an indicator of what's going to happen in a living person, all right? Now, I have in my own practice, I've used ideas that I saw worked on a Petri dish, and I told patients, I saw that this worked on a Petri dish. Let's try it on you because we're running out of ideas. I can't guarantee it's going to work, but let's see, all right? So for instance, many of you may be aware, I like using the herbs otoba bark and cat's claw to treat Lyme. And that's because there were some good Petri dish experiments that showed they worked really well. So I started using them, and clinically, I saw they do a great job. So that's how I started using them, okay? But likewise, I have seen things work on Petri dishes, such as stevia. Many of you are familiar with stevia. There's good evidence that they work well on a Petri dish, but in a human, it just doesn't really do anything. It just doesn't make a difference, okay? All right, so looking back at the world of essential oils, yes, I'm thrilled with Ying Zhang's work. I am skeptical that they'll ever have benefit in a living person. And here's why I say that. About 4 or 5 years ago, we went through a craze, and I'll call it a craze. Everyone was starting to do doTERRA essential oils. There was a bunch of people that were in antibiotic treatment, and they just stopped doing it, and they moved over to doing the essential oils, all right? Now, there are some people that got help with that, but the majority of people did not have lasting benefits from it. And they eventually had to come back and get back into either herbal or prescription antibiotics. That's when I was in practice, all right? And my opinion is, I think the problem is with essential oils. I think on a Petri dish they can kill, but that's because they're being literally put directly on the germ. The problem with essential oils is when we take them orally, I don't know that they're getting adequately absorbed in any meaningful way into the bloodstream where they can then get at the germ, okay? It'll be interesting to see that based on Ying Zhang's research, will people start looking at delivery mechanisms like doing liposomal essential oils, for instance, microscopically wrapping them in fat in a way that they can get absorbed. I don't know. But I bet somebody's going to start looking at those ideas. I haven't seen any research on that yet, but I'm interested in the essential oil research. I am very aware of what happened with all the people going and trying doTERRA essential oils a number of years ago, and we found that in the end, most of them had to come back into treatment. So I'm skeptical, very skeptical, that in real world experience that we're going to see people get a lot of benefit from doing the essential oils. All right, that's just my opinion on it. Okay, thanks, Barry. I want to just do a quick screen share here again. All right. So I mentioned persister Lyme, and I want to let you know there are a number of treatments that I did find helpful in my practice, not uniformly helpful, but helpful often. And so I just want to show you the article on that. So there is this article called How to Treat Persister Lyme, What Works, okay? And this is based on some of the limited science out there and also about what I just saw in my practice, all right? So anyhow, down here, I talk about Dr. Zhang's studies using prescription antibiotics. And then I do mention down at the bottom new ideas, and that's that Zhang continues experiments to identify drugs and supplements for persister Lyme. And that he has taught, in this section I mentioned he had oregano oil. I need to up that date to say that he found a number of other oils besides oregano oil that can be helpful. But again, I think it's way too early to see if that will have long-standing benefit for people. Okay? All right. Barry, thank you for that question. I know I'm having some really long-winded responses tonight, but they're not simple questions either. There's a lot of things to consider. Okay? All right. Good luck to you. Hello, Sarah. How do I treat depersonalization, derealization? So let me just make some comments about, I can't tell you specifically what to do, but I can tell you some things to consider, okay? And these are things you might even want to talk with your physician about. So in the world of Lyme disease, when you see people that have mental health issues or mental health phenomenon, I guess I would call that, and I would say depersonalization, derealization falls in that realm, okay? The thing that many of us are aware of is that when you see situations like that, that it's a valid thing to consider, does the person have a Bartonella infection? All right. Bartonella is known for giving problems with mental health issues, severe mental health issues, and some severe anxiety, severe depression, bipolar disorder, hallucinations. The whole realm of psychiatric issues seems to be worse if there is Bartonella, or could even be caused by Bartonella. All right. Now, having said that, I will let you know Lyme can sometimes trigger those things too. But so one idea for you to consider with your physicians is, do you have Bartonella? All right. And although I mentioned earlier that you got to make decide whether you have Bartonella based on symptoms, I failed to show the article. I'll show that to you here in a minute, so you can go back and look at that later. Okay. All right. So that's one thing to think of. There are medications that sometimes can be helpful. Herbal wise, I haven't found good herbs that help with this problem. The big thing I would look at though is there Bartonella? Okay. All right. Let me show you, do a quick screenshot. I'll show you that article that you can take a look at later. All right, so take a look in my online Lyme guide. Look in the mental health section. Okay, and actually, no, it won't be here. Take a look at the how to diagnose section. And this article called It Could Be Bartonella or Babesia. Okay, and I talk about both Bartonella and Babesia. You got to diagnose based on the symptoms, all right? So Bartonella symptoms would be things that make me think about Bartonella in person are day sweats, ongoing anxiety, pain on the soles of the feet, swollen lymph nodes, a rash that looks like scratch marks, or stretch or scratch marks, severe thinking problems, neurologic symptoms such as numbness or sharp stabbing, shooting, burning pains, unexplained abdominal pain, bladder symptoms, and psychiatric problems, okay? The range of psychiatric problems, all right? So if you've got a number of these things going on, I bring it to the attention of your physician. You may even want to print off this article and bring it to them, okay? All right. All right. Good luck to you, Sarah. Hello, Stephanie. Hold on here a minute. Let's see. Can you summarize the possible complications with getting pregnant, given being diagnosed with Lyme, especially given my symptoms have been gone for a few years now? When we last spoke, you mentioned needing antibiotics while trying to get pregnant through breastfeeding, along with the possible relapse of symptoms after childbirth. I have been unable to find resources on this, so if you could provide some for future reading, that would be appreciated. All right. Let me, I'm going to do a quick screen share so you can take a look at this article that I have first, okay? All right, so take a look at my section on pregnancy here. Okay, and there's an article where I talk about some of these issues, and it's called Lyme in Pregnancy, Will My Baby Get It? What About My Health? All right. And it's here that I try to review some of the information that's out there. There is limited science on this, and I outline some of it here, okay? So take a look here, and this would be the most that you're probably going to find somebody write about it, all right? Now, in terms of, and you may be aware of this article, all right? I suspect you may be. Anyhow, there aren't many resources out there. That's the problem. Most of this is based upon just what we've seen in our practices, okay? The big thing, there was a pregnancy registry that was kept of women that had Lyme, and we followed what happened with those women and also their babies, all right? That was kept in the late 80s, early 90s out in Connecticut, I believe. And through that registry, registry means it wasn't a formal research project, but in that registry, it was found that around 50% of the time that a woman had Lyme and then it was not on antibiotics, about 50% of the time, the infection would be transmitted to the baby. Okay, all right. That is probably the best evidence that we have. There are a limited number of other studies, and I outlined those in that article with small populations that showed that there has been Lyme transmitted. And it looks like on those studies, when you look at those studies, that maybe it's about 25% of the time. But that pregnancy registry showed that it was transmitted around 50% of the time. All right. Now, what I cannot find anywhere, though, is the issue of what if you're symptom free? All right. So in that pregnancy registry, it's not known to me. I haven't been able to find out whether these were people that had a lot of Lyme symptoms. So if you have a lot of Lyme symptoms, does that mean there's a greater chance of transmitting during pregnancy versus if you don't have Lyme symptoms? And what I can tell you is I don't know. I haven't seen any science on it. And we cannot tell by the information that was given out about that pregnancy registry as to what the health status was of the woman that the information was collected on. I just don't know, all right? Is it possible that if you've lived years without Lyme symptoms, that maybe you won't spread it to your baby? It's possible, but I just don't know, all right? Let's see here. Yeah, I'm sorry, Stephanie, that's the best I can provide is that article that I have for you, okay? And just that experience that I have for you too. All right, good luck to you. Suzanne says hello. Hello, Suzanne. Thanks for the hi. Susan says hi, Dr. Ross. Hello, Susan. That's good. Thank you. Hello to you too. Hello, Lisa. Let's see. Hi, Doc. First off, wondering what the latest is with you reopening your practice. Secondly, let me know what you think of this protocol. I am on Lyme and Bart. Pyrazinamide, which is PZA, 1,500 milligrams daily. Rifabutin, 150 milligrams twice a day. Doxycycline, 150 milligrams twice a day. CM Core for anti-persister support, and antifungal Bycell extroches. My usual SS or symptoms, I think that's what you mean by SS, improved except fatigue, but recently relapsed with past symptoms due to stress. All right. So what I can say, I'll come to the practice here in a minute. In terms of Bartonella, when you put together Bartonella treatment, I always found it best to use at least 2 antibiotics that would treat Bartonella that are intracellular antibiotics that get inside of cells and can have a better chance of getting in the Bartonella, and to use at least 2 at the same time. Okay. Pyrazinamide is a tuberculosis medicine. I know some of my colleagues are using. I tried a couple of times. I didn't have good or bad results with it. Okay, but it does get at Bartonella inside of cells. All right. Rifabutin is in the same family as rifampin. That is a good dose. The pyrazinamide, that is a good dose. And then the doxycycline is, and this is an extended release variety you're using, also gets inside of cells. So this is a triple antibiotic regimen of medicines that all get inside of cells and can treat Bartonella. So my impression of this regimen is it looks good. I can't say for sure that it will work in you, because the only way to really know if any of these are going to work in a person is to try them out. But this looks like a valid regimen based on my opinion. And it looks like one that it uses at least 2 or 3, this one 3 drugs, but I like using at least 2. And if somebody doesn't get over Bartonella, sometimes I'll use 3. In my practice, I would use 3. And so this seems to be a valid treatment. Okay. And it may work. Those are good medicines. Okay. In terms of reopening my practice, I'm still trying to sort it out. My preference would be to see if I can actually stay here in Texas. I've kind of reestablished here, but to get relicensed in here, it takes 2 steps for me. Okay, number 1, Washington State, although I've been cleared in their recent investigation. Remember, they came up with this investigation to go back after me again. They claimed that I was doing human experimentation in my practice on people. It was all false, and I told them it was false, but anyhow, they did their investigation, and I thought they were doing it because they really just wanted to take my license. They were going to find some reason. That whole investigation has gone away. They didn't find anything wrong, and they really looked at the charts of some really sick people in my practice, where I did the full range of prescription and natural medicines, and they came back and said nothing is wrong. The original case that brought me to their attention was over a patient of mine that had Lyme and mold toxin illness, for which I was using Ambien at high doses to manage her pain. And many of you are familiar with it. It worked, and it had been started by a pain management doctor. But that's what got them aware of the way I manage Lyme. And it was appropriate. They looked at me. I just don't think they should have punished me. Now, that punishment is still in place. That's something called a stipulation agreement. And with the terms of a stipulation agreement, it's like a contract. In return for them agreeing to let me stay in practice, there were certain things I had to do. And I've done all of them, okay? So I should be able to get released from the stipulation agreement, especially since they recently did another 20-person chart audit of my practice and found nothing wrong, okay? So anyhow, I cannot get licensed outside of Washington State until I get released from that stipulation agreement. So I'm working with my lawyer at this point to petition them to let me go. I met all the terms, and so we should be able to get that handled. But that could be like a 3 to 6 month process still. Once that's done, then I have to apply for licensure down here. And because of what happened up in Washington State, it could take anywhere from it could take 9 months to a year. So it's going to be some time. So it isn't going to happen tomorrow. And so anyhow, I'll keep you posted over time. All right. But that's where I am at this point. All right. Thanks for that question, Lisa. Hello, Robert. Let's see. Is there a group of supplements you suggest for small fiber neuropathy caused by Bartonella? That was otherwise successfully treated. So, Bob, I would, the thing is, I would suggest. So here, I'm trying to figure out how to answer your question. So a neuropathy, which means nerve damage, and in this case, these are small fibers, nerves that got damaged. I have had success in my practice working with some supplements to repair neuropathy, and that was both large fiber and small fiber. Okay, and that would be to take steps to repair the nerve cell outer membrane or the membrane of the nerve cell, to repair the inside of the nerve cell. And then to fix the energy factories in the nerve cells called mitochondria, so they can provide enough energy for those nerves to heal. Okay, and so there are a few things that I have recommended to my patients that seem to work well. They work about 60 or 70% of the time, and even in this kind of a situation that you're describing, I would find it would work about 60 to 70% of the time. And that is to use a phospholipid mix to repair the cell membrane as well as the mitochondria. Second thing is to be on glutathione, which is a very powerful antioxidant that fixes things from the inside. Third thing would be to be on a good anti-inflammatory. I like to have people on, many of you know, liposomal curcumin for that, okay? And then if you're vegetarian, make sure you're taking something called carnitine. Acetyl L-carnitine is the transport vehicle that carries fat and sugar to the inside of the energy factories mitochondria to create cell fuel. All right. And then you could even person could consider adding coenzyme Q10. All right. Now there's an article I've written about this, but again, even for small fiber neuropathy, the article that I have written about this, the plan the steps I say to take in it apply to small fiber neuropathy based on my experience. Okay. All right. So let me just show that to you here. So this article has the specific doses that I have found helpful, okay, and the specific supplements to use. So let's see here. There it is. So it's this article called Neuropathy Repair, Heal That Tingling, Numbness, and Pain. And the steps I outline here apply to both large fiber and small fiber illness, okay? So everyone, large fibers are the big nerves, are the big ones that initially come out of the spinal cord. They run down your elbow throughout the body, but then they branch and they get smaller and smaller and smaller until they're literally just these really small fibers. Those are called small fibers, okay? So it's like the end branches of the whole nervous system, basically, right? Thanks for that question, Robert. Good luck to you. Hello, Suzanne. Let's see. Suzanne, oops. I don't know why you're saying oops, but suggestions for constant head pressure with brain zaps in a mold environment that is hard to get away from. Thank you for all you do. Wow. I will tell you, it may be hard to get out of that environment, but my experience in this kind of a situation, for what you just described, is unless you get out of that mold environment, it's going to be hard to get rid of those brain zaps and the head pressure. It just will be. All right. Whatever it takes, I would try to get out of that environment. If you can't get out of that environment, In similar situations, when I had patients that could not get out of the environment, then what I found was at least putting them on binders to remove mold toxins would at least help lower some of the mold toxin load. Okay. Those are some thoughts. I'd talk it over with your physician. Obviously, I can't give you direct advice here, but those are some things to think about. Okay. Mold binders, if you're wondering when I talk about mold binders, which ones am I talking about and what to use, take a look at this article. And this is, you can find my mold toxin article in the detoxification chapter. And this is where it is right here. And in here, I talk about mold toxin illness and I talk about binders, the things you can use to help remove it. Okay. But I will tell you, based on my experience, it's hard to keep up with all those toxins if you're living in a moldy environment. It just is very, very hard to do. Good luck to you, Suzanne. Hello, Christy. My Bell's palsy has been getting worse and my legs are going numb more often. Is this more due to the Lyme or a co-infection? So both Lyme and Bartonella can be infections that can cause this, okay? As to which one's making it worse, it would be hard for me to say. But if things are getting worse, you want to talk to your providers and make sure that they're covering. Look at, is Bartonella active in there? Okay, so look at the symptom list that I showed earlier. Bring that symptom list to your physician if you need to, but look at those symptoms. And if you've got a number of those things going on, then it may be appropriate to consider adding, with your physician, Bartonella treatment, okay? The other thing sometimes that can lead to deterioration of the nervous system over time from having infection of both Lyme and Bartonella is that chronic infection can lead to injury of the cell energy factories called, called mitochondria. All right. So many of you may be aware I've got a whole article series about what do you do to fix the mitochondria. But essentially, each one of our cells have an energy factory system in them called mitochondria. Okay, and there's about 300 to 400. Inside the mitochondria, fat and sugar are burned through a bunch of chemical reactions to create cell fuel. All right. Now, the covering of the mitochondria is a double layer of fat. And when that double layer of fat can get damaged by oxidizing agents, like even ozone that some of you use, that can damage the covering of your mitochondria. Okay. All right. Hydrogen peroxide is an oxidizing agent. That could even damage it. But germs, when the germs are in us, the way the immune system tries to get rid of them is it manufactures oxidizing agents. And over time, those oxidizing agents can damage the mitochondria membrane. Okay. All right. And so what can happen is if you get damage to your mitochondria membrane, your cells don't have enough energy to recover, to heal. All right. So one of the things that I often would do in my practice when I had somebody that we were treating and they just kept having more of a deterioration of the nervous system, I would make sure that I was doing things to support the mitochondria. And that would involve using a product to rebuild the mitochondrial membrane. And in my practice, what I liked using was either or a product that would have the fats in it to rebuild that mitochondrial membrane. Those products that I liked were either ATP Fuel, NT Factor, and I like the newer product by Research Nutritionals called ATP 360. Okay, any one of those three can help rebuild the mitochondrial membrane. And there's some science that shows that actually when people take it, that they actually get better energy. There isn't any research that shows better nerve function, but my practice experience was that repairing that covering could get your nerves working better as well too. Okay. All right. Second thing that I would suggest that people do for mitochondria repair is be on glutathione. And then the third thing is deal with getting the inflammation down by using like a curcumin. Can be very helpful for that too. All right. So take a look, that same article that I just showed for the last question about neuropathy repair. take a look at that. Those are the same steps. Those steps to repair the neuropathy is going to repair your mitochondria. I also have a separate article about mitochondria repair. Let me just show that to you too. So take a look at, in the energy and fatigue section, the latest article that I wrote was this one called How to Fix Mitochondria and Get Energy in Lyme Disease, okay? Take a look at that. I lead you through the steps to fix your mitochondria, okay? All right. All right. Good luck to you, Christy. Thanks for that question. Hello, Kim. Let's see. I am due in July with our third baby. First, while I've had Lyme, although my doctor here is pretty sure I'm in remission. I have been treating with antibiotics the whole pregnancy. What are your thoughts on testing the cord blood and or placenta at birth? Or do you test the baby itself? Also, if yes, would you treat a newborn based on a positive test? Thank you. So Kim, so in terms of trying to decide if, so first of all, in my experience, when I was treating women that had a pregnancy and Lyme, and I always would recommend that they be on antibiotics. And in my practice, probably over time, I probably had about, I don't know, maybe about 50 different women or so that saw me that were pregnant. I did not see in any one of those that there was transmission of all antibiotics. Okay, all right. And in fact, those pregnancy registry studies I mentioned earlier also showed that when a woman was on antibiotics, there was not transmission. Okay, all right. So that's the reason to do antibiotics. So I wanted to say for that, there probably is a very, very low to minimal to no risk that there is transmission, especially since you were on antibiotics. All right. Now, in terms of testing your baby, in terms of the tests we can do, the two tests that you might do, and one, let me talk about what you might do and then tell you why you would not want to do one of those, okay? So one way that we can test is to do a blood test on the baby and do a Western blot, okay? Now, Western blot is a way of measuring to see, are there antibodies in your baby that are there to fight Lyme, all right? The trouble is that the initial antibodies that are in your baby are actually the ones that your baby got from you. So it's not going to be useful. Also, if you're breastfeeding, your baby may be getting some antibodies from you, all right? So generally, the Western blot is not going to be a useful test at really looking at the baby's immune reaction to possibly having Lyme in them until about a year or later, okay? So I don't advocate doing Western blot testing in babies until they're a year old or more, okay? All right, then. The other thing, though, that can be done, and that is at delivery, is to have a cord blood from the umbilical cord blood drawn, and then have it sent to a lab that will do PCR DNA testing to see, is there virus or Lyme germs that got into the baby's blood system, okay? And that's a PCR test. PCR is stands for polymerase chain reaction. It's a way that we amplify the DNA of the germ so that we can actually see if it's there, all right? And so IGeneX out in California, if you were to have your doctor get a hold of them, they could send out a test kit to draw cord blood at delivery to see is there Lyme there or not, okay? All right, now a third thing that could be done is to actually do a placenta biopsy too, all right? My experience in my practice was only to do the PCR of the cord blood though, all right? So if you do want to test, again, I think that's a minimal chance to almost non-existent chance, especially if you're on antibiotics during pregnancy, that your baby got it. But if people do want to test, what I would do is the PCR cord blood only. I would not do the placenta biopsies in general. All right? All right. Good luck to you, Kim. Let's see. Oh, your second part of the question. Would you treat a newborn based on a positive test? If I Boy, that's a hard one. So, if your newborn is PCR positive, that means that there is bacteria in your baby. If I had a baby that had a cord blood that was PCR positive and they had symptoms suggesting Lyme, I definitely would treat. All right. If, on the other hand, the baby has positive cord blood but no symptoms, I still, in that situation, would treat to try to prevent the germ from becoming, lodged in the body, if you will. And in that situation, I might treat with an antibiotic for about a month. I might do an amoxicillin, for instance, okay? That would be my approach. If you had a baby that had a positive PCR test from the cord blood and had a lot of symptoms, I would treat until the symptoms were gone. That would be my approach, okay? All right. Good luck to you, Kim. Hello, Mary. Hold on here just a minute. Let's see. Hi, Dr. Ross. Is it possible for Lyme or co-infections to hang out in areas of the body that ultimately cause symptoms? 30 years ago, I had reconstructive jaw surgery. Now, periodically, I have weird, not really painful in the area where plates and screws were put to correct my jaw. Also, I had head and neck surgery 8 years ago with complications of phrenic nerve damage, resulting in my diaphragm being elevated for 18 months. Fast forward, I have chest pain now, mostly at night while sleeping. I awaken from this symptoms, also wake with terrible head pressure, which takes some time before it dissipates. I just started Cemento to see if this helps. Your thoughts. Thank you very much. You're welcome. So, just an observation. So Lyme basically likes to live in tissues that don't have good blood flow, all right? And the reason is oxygen is toxic to Lyme. Oxygen can kill Lyme. So Lyme likes to get into tissues far away from blood flow, all right? So one of its favorite tissues is scar tissue, all right? Scar tissue does not have much blood flow at all. And so it's not uncommon at least what I saw in my practice, is it's not uncommon that people would develop symptoms where there could have been scar tissue, all right? And so maybe, when somebody starts having a return of a lot of inflammation and pain in those areas, perhaps, I can't say for sure, but maybe that's an indication that Lyme could be active in those areas. In terms of treating Lyme, as you know, there's herbal antibiotics that I find helpful. I generally would not use Cemento, which is cat's claw alone. I'd like to combine it with a second herb. And I found it more successful to use the two herbs together, and that was to do cat's claw along with Otoba bark, okay? I have an article about that. I can show that too, okay? All right, so I started using, again, Otoba bark and cat's claw based on the Petri dish experiments from Eva Choppy that showed that they can be really effective when used together. And in fact, those experiments showed that on Petri dish experiments that if you used Otoba or you used cat's claw individually, they both did a good job of killing the various forms of the Lyme germ and getting rid of biofilms. If you put the two herbs together on a Petri dish, there was a whopping kill, a greater kill than you might expect from just combining the two herbs together, okay? So that is why I advocate using the two together. I think there's a synergistic effect, meaning they both somehow cause the other one to do better, okay? So anyhow, here's the article I have about them. So Otoba bark extract, cat's claw tinctures. All right, so you can get them as Otoba bark and cat's claw. There are manufacturers that just make them. Nutramedics makes a Otoba bark tincture called Banderol, and they make a cat's claw called Cemento. That's their version of it, okay? All right. In this article, I review Eva Choppy's science and her experiments that got me thinking about using these two. These two herbs I find work on patients with chronic Lyme effectively about 85 to 90% of the time. It's the same kind of success chance that I would see with any two antibiotic combination that I might put a person on. Okay, so they're valid herbs and they can do quite well. All right. Mary, thank you for that question. Good luck to you. Hello, Ashley. Let's see. I tested positive to EIA and non-reactive to the Western blot. I understand the results have to be interpreted in the context of clinical signs and of symptoms. I have a history of autoimmune conditions, colitis, hidradenitis, and severe migraines with speech impairments, confusion, and paresthesia. What do you make of the ELISA test, and do my results suggest a possible Lyme diagnosis? What are your thoughts on the TICPlex Plus test? How reliable is the kit in your opinion? All right, so the problem with the ELISA test is that it can give false positives. All right, so the ELISA basically answers the question, could you have an infection in you? But it doesn't tell you for sure, because the ELISA can be positive from having chronic virus infections in you as well too. All right, so it's not a full indicator of whether you have Lyme or not. My opinion, the TICPlex, I think, is still too young to know if it is going to be solidly useful in this situation, okay? The two tests that I would suggest considering, or I would consider in a situation like this, I should say, with patients of mine, is a test by IGeneX, which is called an immunoblot. Their immunoblot test, they call it immunoblot, is different than their Western blot, all right? So Western blot, the way that we do a Western blot is we basically grow a bunch of Lyme germs in the lab, and we kill them and we take their proteins from their covering. And then we distribute those proteins on a test strip, and we, based on what they weigh, and we see, do you have antibodies that attach to these various proteins, okay? All right. In an immunoblot, we genetically modify these Lyme proteins and we grow them inside bacteria. And what we do in the genetic modification is we remove any parts that might allow for antibodies from viruses to attach to the germ. So we basically decrease the chance of a false positive test, all right? So it's a cleaner test. Secondly, when IGeneX does their immunoblot, they're looking to see if you have antibodies against 8 different kinds of Lyme germs, all right? Versus their Western blot is only done against 2 strains of Lyme germs. If your Western blot was previously done using an FDA test kit, they're only looking to see if you have antibodies against 1 strain of a Lyme germ, all right? So the testing using the newer IGeneX immunoblot IgM and immunoblot IgG, their internal validations studies suggest that it can find Lyme if it's in you 93% of the time. I think it is probably the best test out there based on my opinion, okay? All right. The other option is to see, would be to look at doing a lab that I would suggest doing through, if you're going to do this, my opinion is the better lab doing this is a lab called Armin Labs out of Germany. You'd have to get a test kit from them, but that's the Armin Labs ELISpot test. And the ELISpot test from Armin, basically what an ELISpot method does is it looks to see, we draw your blood and we take your white blood cells, a type of white blood cell called a T cell. And we put those in a test tube, and then we introduce Lyme proteins. And we see, do those T cells react against those Lyme proteins by making cytokines. We measure the cytokines, okay? The only way they're going to react against those Lyme proteins is if they have seen Lyme in you before, all right? So it's a T cell kind of memory test. And that test has the ability to find Lyme about 85% of the time based upon various studies out there, all right? So the tickplex, I think, is just, it's a little bit too early to say for sure. So that would be my response on that, all right? Good luck to you, Ashley. Hello, Ron. Let's see. My sister Elizabeth was given 2 weeks of 100 milligram doxy twice a day, which ran out. She wants to begin 200 milligrams 2 times a day, but isn't sure whether she should wait or start as soon as she can find a doctor willing to prescribe a more appropriate dose. What is your experience in the past of antibiotic treatment strategies? All right. So the Infectious Disease Society of America and the United States Centers for Disease Control call for the treating of acute Lyme or Lyme with 2 to 3 weeks of antibiotics. And the first antibiotic they recommend is a doxycycline, 100 milligrams twice a day. All right. So that's how your sister wound up probably getting on that. That's what they tend to recommend. However, the problem is with that approach is there's good studies that show that treatment fails around 10 to 20% of the time, or on average 15% of the time. All right. So people that get that treatment, even for acute Lyme, there are studies that show that 2 to 3 weeks of doxy, 15% of those people will fail and develop chronic Lyme disease. All right. The ILADS, the International Lyme and Associated Disease Society, on the other hand, has a different set of guidelines. And what they would basically call for is up to 2 months of doxycycline for an acute bite, anywhere from actually 1 month, 30 days, up to 2 months, okay? So those are some things for you to consider. My observation also is that it's best not to take a break. If you're getting treated, if you interrupt treatment, that's a greater chance that the germ can take off. So it's best not to take interruptions. Okay. All right. Ron, thanks for that question. Good luck to your sister. Hello, Susan. Let's see. Hi, Dr. Ross. I was diagnosed a year ago with Lyme, Bartonella, and Babesia. I've been taking Zithromax, Tindamax, Mepron, berberine, transfer factor L+, serapeptase, CoQ Max, vitamin D, Monopure Omega, and Probiomax daily. My regular bowel movement is loose, my body hurts, my hands hurt, and I have a metallic taste in my mouth, which makes me not want to eat much. Does this mean it's still very active? And when or how might I begin to feel better? Thank you so much. Okay. So the metallic taste, I just would raise that the metallic taste may be a side effect of probably the Tindamax in this kind of a situation, okay? The brother or sister of Zithromax, which is called Bycell, is known notoriously for giving metallic taste. I never found Zithromax to do that. Tindamax, I did occasionally have people that would describe a metallic taste, all right? So in all likelihood, that metallic taste is coming from one of your medicines. Most likely, based on my experience, it's probably from the Tindamax. Okay, that's my opinion. I would definitely talk to your physician about that, just because I can't treat you, but definitely talk to your physician about that. Okay. All right. Now, something else to talk to your physician about is if you've been treated for a year. Actually, I think you're saying you've been on these antibiotics for a while, but if you've been on these antibiotics for a while, you're not getting better, and you've got a lot of pain and inflammation, and you've got loose bowel movements. The thing that I would see in a situation like this is that the antibiotics that you've been on, even though you've been on a probiotic, may have increased the chances of yeast in your intestines growing too much. Okay, so we all have bacteria and yeast that live in our intestines. They keep each other under control. If too many yeast grow in your intestines, the immune system is going to react to too many of those yeast by making more inflammatory cytokines. Okay, and remember, I even talked about earlier tonight that when we look at Lyme disease, what Lyme disease symptoms are really too many cytokines. Well, if you've got something else triggering cytokines like too many yeast in your intestines, it's going to make it look like your Lyme's not getting any better. It could even give you more of that joint pain. Okay, all right. So in situations like this, right, somebody that was had a lot of pains, wasn't getting better, but also started having some GI disturbances like gassiness or bloating, other things I would look for, increased sugar cravings or decline that happens after having sugar or having to avoid sugar so you don't feel worse. Sometimes also when you get too many yeast, the other thing that can happen, you can wind up getting a lot of pimples. Acne and pimples seem to get worse. Eczema, skin problems seem to get worse when you have too many yeast. So I would look to see, are there too many yeast? If you have a lot of symptoms of too many yeast, one thing that might be beneficial is to treat for too many yeast, okay? But I discuss that with your physician as well too. So let me show you an article that you might bring to your physician so that you can bring this to their attention as well too. All right. Okay, so take a look at this chapter I have called yeast. All right. And here's an article I've written about, do you have yeast? Okay, and I go through why you might want to consider it. All right. And this other article, I talk about how you're going to get rid of yeast, okay? And then the one thing, you might even take a look at this article called Steps to Fix a Lyme Treatment Crash. This is where I really make the case that if you get a lot worse after you've been doing better or don't really seem to be making any improvements, consider yeast, okay? Take a look at those articles, okay? And I discuss this with your physician as well too, all right? All right, Susan, good luck to you. And thank you for that question. Hello, Christelle. Let's see. Hello from France. Hello. Bonjour. Actually, I guess it would be, well, no, it's probably nighttime there, but anyhow. So if a patient is positive for ELISpot from Armin Labs, Borrelia B full antigen weak positive, plus Borrelia B osmic positive, but if Spherospot IgM is negative, what can we conclude? Should we treat him for Lyme? Even if the Horowitz score is borderline, no migratory arthritis, only memory loss, mood swings with anxiety and fatigue. So, Chris, the way you're asking that question makes me think you may be a physician as well too, or a medical provider of some kind. So the thing is about the, again, let's talk about the two test techniques are different. Okay, so the ELISpot, the Armin Labs ELISpot, is looking to see, is there a T cell reaction? Do the white blood cell T cells remember seeing Lyme? And if it's positive, it means that the Lyme has been in that person sometime over the last 2 months. Remember that T cells, or actually many of you may not remember this, but T white blood cells are cleaned out of the body every 2 months. All right, so if we're measuring, we get a positive test on the ELISpot, it means that sometime in the last 2 months that germ has been in you. All right. All right, so that's measuring T cell reactions. Now, because of immune suppression, sometimes the body can't make antibodies. And the Western blot, which is what the Spherospot is, that's a Western blot, that's measuring whether the person is making antibodies. All right, so ELISpot looks at T cell part of the immune system. The Spherospot, or which is also a Western blot, is looking to see, do you make antibodies? That part of the immune system, okay? All right. It's possible one part may not be working well, and so it can't be measured. So I would probably call this a positive test. All right. Now, the problem is we can have false positive tests. Okay. So in situations, I always felt better in my practice about treating for Lyme if, in addition to having a positive test, were there other things that made me think Lyme could be there? Okay. So one of those is there's a greater chance of having Lyme with a positive test the greater the number of symptoms. Okay. That's one thing to consider. The other thing to consider is what are the risk of getting it? So, and I can't tell here from this question, but if it's a person that did a lot of hiking, backpacking, especially in areas of Germany, for instance, where we know there's lots of Lyme there, and by proximity, France would have some too, or in areas known to have Lyme, or is this a hunter? Is this, people that have a greater risk of getting it? That increases my thinking that there could be Lyme too. Okay. All right. So, and yeah, I see that's a borderline Horowitz score, but it's possible. I can't tell you for sure whether to treat or not. What I would say is if you're coming up in a situation like this, I would consider what else could be causing this. And if I could not find a good enough cause, and there were some things pointing towards a Lyme disease diagnosis like this, I would do a treatment. Okay. The other thing that you might want to keep in mind with this is that memory loss, mood swings, anxiety, and fatigue can often be seen part of Bartonella. All right. So take a look at the resources I have about how do you diagnose Bartonella based on symptoms. So it's possible that his major symptoms, let's say he was bit by a tick. I mean, the ELISpot would suggest it. Maybe there were other things transmitted like Bartonella, and even the Bartonella ELISpot from Armin is only going to test for 2 strains of I think 1 or 2 strains. And keep in mind, there are 17 strains that we think can infect humans. So it's possible that there could be Bartonella too. Okay. All right. Those are some things to consider. All right. Good luck. Good luck. And I think the way you wrote this, good luck to your patient, I think. Okay. All right. Oh, one last comment. Horowitz talks about migrating arthritis and migrating nerve problems, neuropathy, being a pathognomonic for Lyme, meaning being diagnostic of Lyme. Okay, his studies that he's been doing about how useful his questionnaire is. He's done some more recent work looking at, are there certain symptoms that when they're there mean you have Lyme? Okay, and what his studies show is that migrating pain or migrating neuropathy are very much as good as getting a positive Lyme test. Okay, but it doesn't mean if you don't have migrating symptoms that you still can't have Lyme. All right. So I just want to point that out as well too. Okay. All right. Good luck. Thanks for that question. It's a good question. All right, everyone. That's it for me for tonight. I've got 2 Basenjis that need to be walked, and I've got to get some food in myself for dinner here tonight too. I haven't eaten yet. So been good to be here with you tonight. Keep an eye on your email tomorrow, somewhere between 9:30 in the morning on Central Standard Time here in Texas, and we'll get an email out to you. If you miss it, again, you can find it on my homepage at treatlyme.com, which is the store, at treatlyme.net, which is my Lyme disease information site, my Facebook page. You can find it. Okay. All right. I hope you'll join me for next webinar next week, and you can sign up again for that tomorrow as well too. All right. Good night, everyone.